3 years ago, a 72-year-old man sat across from me. Every morning he took 4 different medications, yet his blood pressure stayed dangerously high. Not slightly high, consistently high. His previous doctor had already increased the dosage. Twice. Still, nothing changed. He looked at me quietly, calm, dignified. And then he asked a question I will never forget. "Doctor, am I just broken?" That question stayed with me because the answer was simple and completely unexpected. No, he wasn't broken. His heart was working. His blood vessels were doing their job, but something deeper was off. His body had learned the wrong setting, and it kept repeating it every single day, like a thermostat stuck too high. That afternoon, I showed him something different, something no one had explained to him before. And within weeks, everything began to change, not by adding more medication, but by correcting the system behind it. High blood pressure is everywhere after the age of 60. More than half of people in this group deal with it daily. Most are told the same thing: take your medication, lower the numbers. And yes, medication can help. It slows the heart. It relaxes the blood vessels. But here's the uncomfortable truth: it doesn't fix the root cause. Because blood pressure is not just mechanical, it's controlled. There is a system in your body deciding how high your pressure should be every minute, every second. So when you miss a pill, your pressure rises again, not by accident, but because the system was never reset. You are treating the symptom, not the source. Let me explain something most people have never been told. Your blood pressure is not random. It's controlled. Deep inside your brain, there is a small control center. It's called the RVLM. You don't need to remember the name. Just think of it like a thermostat, just like the one on your wall. It constantly monitors your body and decides how high your blood pressure should be every second, every minute, all day, all night. In a healthy system, this thermostat is flexible. It turns up when you need it. When you stand up quickly, when you exercise, when you feel danger, and then it turns back down. Once everything is safe again, up, then down. That's normal. But over time, especially after 60, this system can get stuck, not slightly off, stuck too high. It keeps sending signals. Tighten the blood vessels. Increase the pressure. Stay alert, even when there is no reason. Even when you are resting. Even when you are asleep. That's why your numbers stay high, no matter what you do. Because the setting itself has been changed. So why does this thermostat get stuck? It doesn't happen overnight. It builds slowly. Year after year. Chronic stress, poor sleep, inflammation in the body, metabolic changes with age. Each of these sends small signals to your brain. Not enough to notice in a day, but enough to shift the system over time. Gradually, your brain starts accepting a higher pressure as normal. And once that happens, it stops bringing it back down. Even when you are resting, even when you are asleep. That's why many people wake up with high blood pressure already. Before coffee, before stress, before the day even begins. Because the system never turned off. This is not a failure of your heart. It's a control system that has adapted in the wrong direction. And now, it needs to be retrained. But the thermostat is only half the story. There's another piece most people never hear about. Your body has built-in pressure sensors. They are called baroreceptors. They sit inside your arteries, especially in your neck and your aorta. Their job is simple: measure pressure. Send the signal to the brain. Let the system adjust, like a thermometer on the wall. But here's the problem. As you age, your arteries become stiffer. And when that happens, these sensors become stiff too. They don't stretch like they used to. So they stop reading pressure accurately. They send weaker signals, incomplete signals, sometimes wrong signals. Now imagine what happens next. Your brain receives bad data. It thinks your pressure is lower than it really is. So what does it do? It pushes harder. raises the pressure again and again, trying to reach a target that was never actually missed. Your body is not malfunctioning. It's being misinformed. The sensor is off. The control system overreacts, and the pressure keeps climbing, even if you take your medication, because the signal itself is wrong. So why do medications stop working over time? This is where most people get frustrated. At first, the pills seem effective. The numbers go down. Everything looks under control. But then, slowly, things change. The pressure creeps back up. The doctor increases the dose or adds another medication. And for a while, it works again. But not for long, because your brain is not passive. It's adaptive. The control center we talked about, it notices when something is pushing against it, and it responds. It increases nerve signals. It tells the kidneys to hold more sodium. It finds another way to keep pressure high, not because something is wrong, but because that's what the brain is designed to do. Survive, adapt, compensate. So now, you have a battle. The medication is trying to lower pressure. Your brain is trying to raise it back up. And over time, the brain usually wins. That's why doses keep increasing. Not because you are getting worse, but because the system itself has never been reset. Now here is the turning point. Something most people have never been told. Your nervous system can be trained. Not guessed. Not hoped for. Trained. It has two main branches. The sympathetic system. This is your accelerator. It raises heart rate, tightens blood vessels, pushes pressure up. And the parasympathetic system. This is your brake. It slows things down, relaxes the body, brings pressure back to normal. In healthy people, these two stay in balance. Up when needed, down when safe. But in long-term hypertension, that balance is lost. The accelerator is always pressed, and the brake becomes weak, so the system resets itself around that imbalance. But here's the key insight. You can activate the brake directly, through specific physical signals, not slowly, not vaguely, but in minutes. And that changes everything. Now let me show you something simple, but incredibly powerful. I want you to look at your left hand. Right now, find the soft space between your thumb and index finger. That small web of skin. This point has been used for thousands of years, but only recently, science has explained why it works. This area is packed with nerve endings. When you press it firmly, it sends a signal directly to your brain, and your brain responds instantly. It lowers stress signals, reduces adrenaline, relaxes your blood vessels, and within minutes, your pressure can begin to drop. Here's how to do it. Use your right hand, grip that point firmly. Not painful, but strong and steady. Hold it for 30 seconds. Breathe normally. Then release slowly. You may feel warmth or a slight ache. That's normal. That means it's working. Use this anytime you feel a spike. Now I want you to try it. Do it once. Right now. And if you feel even a slight difference, type the number 1 in the comments. Let me see how many of you can feel this working immediately. Now let's talk about the long-term solution. This is where real change happens. It's called isometric hand grip training, and it's much simpler than it sounds. All you need is a towel. Roll it up tightly. Hold it in one hand. Now squeeze it. Not as hard as you can. About 30% of your strength. Hold that squeeze for 30 seconds. Then relax for 30 seconds. That's one cycle. You'll do 4 cycles per hand. Both hands. Total time, about 12 minutes. But here's the important part. Do not hold your breath. Ever. Breathe slowly. In through your nose. Out through your mouth. Now, why does this work? When you squeeze, your muscles demand more blood. When you release, blood rushes back in. This triggers something powerful. Your body produces nitric oxide, a natural chemical that relaxes your blood vessels. But more importantly, over time, It retrains your pressure sensors, and slowly, your brain resets the system, not temporarily, but sustainably. Now let's make this practical, because knowledge alone doesn't change anything. Here's what I recommend. Every morning, within 30 minutes of waking up, before coffee, before your phone, sit down, stay calm, and complete the 1-2 minute grip routine. Then check your blood pressure. Write the number down. At night, about 1 hour before sleep, repeat the same routine. This is important because blood pressure often rises in the evening. This session helps control that spike. During the day, if you feel pressure rising, use the hand pressure technique. 30 seconds. Anywhere. Anytime. Now, here's what to expect. Week 1 and 2. Focus on consistency. Week 3 and 4. Numbers become more stable. Week 5 and 6. Evening spikes reduce. By week 8, many people see a real shift in baseline numbers. And remember, do not stop your medication. Without speaking to your doctor, this works with your treatment, not against it. Let me tell you what happened to that 72-year-old man, the one who asked me if he was broken. I showed him exactly what you've just learned. The morning routine, the evening routine, the hand technique, the tracking. Nothing complicated, just consistency. 8 weeks later, he came back to my office. Same man, same medications, but very different numbers. His blood pressure dropped from 165 to 128. He sat there quietly for a moment. Then he looked at me and said, "So my body actually knows how to do this?" And I smiled, because that's the truth. Your body is not your enemy. It hasn't been failing you. It's been working with the wrong signals. And once you correct those signals, your body begins to respond the way it was designed to. Before you go, I want you to remember 3 simple things. First, high blood pressure is often not just a heart problem. It's a control system problem. Second, you now have 2 tools. One for immediate relief, one for long-term change. And both are in your hands. Literally. Third, what you don't track, you can't improve. So write your numbers down. Every morning, every evening. Now here's what I want you to do next. Try one technique today. Just one. And if you're willing to take control of your own health starting now, type the number 1 in the comments. Let me see who's ready to take that first step. And if this helped you, share it with someone who needs it.